Welcome to the CaresLink podcast. CaresLink is a digital professional network which connects healthcare professionals with employers and schools. Today we have an amazing guest. Raphael, welcome to the CaresLink podcast.
Thank you very much. Thanks for having me.
I've been really excited about this conversation because I think you have a really unique perspective and what you're building is so cool. Tell me a little bit about your background and who you are now, what you're working on.
Yeah. So my name is Raphael. I moved to the United States in 2014. I came here to finish my undergraduate degree, and I had lived in Brazil where I grew up. Then I lived in Germany for a little bit, ended up moving here, finished my undergraduate degree, and I'm going to preface this a little bit, nothing related to healthcare. I started doing operations, had my undergraduate degree in supply chain management. And when I finished that, I really wanted to work on something that would allow me to see multiple aspects of supply chain. And it's interesting to me because 2016, 17, supply chain wasn't really a thing. People weren't talking about it. It wasn't, oh, supply chain is the coolest thing in the planet. People talk about finance and marketing and engineering, but not really supply chain. And the years go by. I started working first at a company out in Pittsburgh, ended up moving to North Carolina, where I spent almost 10 years of my career. And I'll get to that. But 2020, COVID happens, and all of a sudden, everyone knows what supply chain is. Why? Because there's a shortage everywhere. There's a shortage of materials for cars. There's a shortages of COVID vaccines. And all of this was interconnected in some way to supply chain.
Sure.
It was how fast can you get all of the things to be done for the vaccine? How fast can you get things to your house? How fast can you get, everything data center related, because everyone now is working from home and everyone is using Zoom. And for you to be able to use that, you really needed to have data center in place. So I spent almost 9 years of my career working in data center. I worked at Lenovo at a technology company in North Carolina. The majority of the time that I spent there was in operations, was in supply chain, was supporting our manufacturing facilities all over the world, supporting our customers, was supporting the growth that we've seen over the past almost 10 to 15 years in data centers. It's pretty interesting that everyone knows now what a data center is. And I think over the past year, people know even more because it's all over the news that data centers are polluting cities and there's a lot of restrictions into it. But I spent almost 10 years really in a heavily regulated industry, which is, yes, technology. I mean, the sanctions that happen on the GPUs to China and to India and a lot of other places, because the United States is trying to position themselves as a superpower. And all of that to say is a little bit of my background comes from this. When I worked in Pittsburgh first, I worked at a chemical industry, which is also heavily regulated. Then you go into the technology industry that's becoming a lot more heavily regulated and understanding what that is. And then for the past now a year and a half, building Compass Health, which I know we'll talk a little bit about, but the healthcare industry also heavily regulated. So understanding a little bit of that background for me was crucial because, yes, you can be nimble and you can do a lot of things in a quickness way, but there's also that layer of, yes, there's going to be regulation. Yes, there's going to be new laws coming all the time. Yes, you have to pivot when those come through. And that's what over the past 10 years really surfaced. So that's a little bit about me on a personal level. We talked about this. I'm married. We moved down here to Tampa about 5 months ago, expecting a little baby boy.
Congrats.
Coming next month. So I like to always mention that, yes, part of my background is exciting about the actual companies and who I'm working for, but at the end of the day, what matters really is family and the human side of it. So excited about the baby boy.
Yeah, absolutely. And even though you don't have a background necessarily in healthcare, it sounds like, the compassion and the, experience in different regulated industries, it sounds like you're probably uniquely positioned to be successful.
Yeah.
In your past lives, like working at Lenovo, what were you good at? What did you really enjoy about that position?
What I was good at, I feel like for you to be able to really excel, this is my opinion, excel in life in general, I think there's a couple things that I value a lot. One of them is being honest and genuine to people. It doesn't matter if you're working with technology, if you're working with healthcare, if you're working in the chemical industry or whatever that is, there's always going to be people on the other side of it. And that could be customers, that could be suppliers, that could be your colleagues. So it's being genuine and honest about everything that you need. And then two is how hard you work. I've excelled and I've put myself forward always as I am going to work as hard as I have to. It doesn't matter if it's in operations, if in sales, whatever that is, I'm just going to beat anyone on how hard I can work. And number three is going back to your question, what were you good at? I feel like building teams and making sure that everyone was excelling in what they're really good at was one of my superpowers. My previous manager used to say that Rafa's been here for almost 8 years and I have no idea how he knows that many people, because it was just this aspect of connecting with others and making sure that you understand how you can help them, how they can help you, and how you put them in positions that are the best way for them to succeed, and therefore the company will succeed together with it.
What was your position towards the end of your tenure there?
Yeah, so I was the chief of staff to our vice president in supply chain. So our team was over 600 people all over the world. I used to travel with him, conferences, supplier visits. My last year, we went to China, Hungary, Mexico, the UK. I had a team in each one of those locations apart from China. Because we were building new manufacturing facilities. So last year alone, we were building manufacturing facilities in the US, we're building manufacturing facilities in India. There was always new manufacturing facilities coming about in other places of the world and expansion. So that was my last role. So I was a senior manager and chief of staff, leading a very large team, and also responsible for one of our major relationships with Gartner.
Okay.
And that was my last role. But going back a little bit, what was I good at? Relationships, really working hard, leading teams, and making sure that people were uniquely positioned to really succeed and to be able to help the company the best way that they could.
Sure, yeah. Your ability to build an effective team obviously contributed to your success at Lenovo. It also seems like it's probably a pretty big aspect of your current venture with Compass Health. Can you go into that a little bit?
Yeah, so with our current venture and with Compass Health alone, we are building the team as we grow. And one of the things I talk a lot to our co-founders is, yes, I want to grow. I want this company to be very successful. But like anything in life, we have to focus on who is it that we're helping.
Yeah.
We're helping the patients. And if we grow too fast and we have too many patients and we are not positioned in a way where the operational excellence remains the same to all of those patients, they're going to leave. So what kind of experience do I want our patients to have that it doesn't matter if I have 5 patients or I have 1,000, they're all going to have a very, very similar experience. So our intent has been, yes, we're going to grow in a way that is strategically grown, so that I can build the team along with building the number of patients and customers that we're going to have. And that's how we are framing this. So we had one care coordinator that is working with all of our patients today. We're in the process of hiring a second care coordinator. And as we understand that that's the need to the cap of patients that we're going to try to have for year 1 and year 2, what are also the other aspects of the back end? When I call the back end, do I need anyone running operations? Do I need anyone to come help on the marketing side? Do we need to start doing more business development? And I think that's going to uniquely position, as long as I have what I'm going to call my customer service for my patients really well tight, so that I'm not running any issues with the patients, with our customers,
Sure.
and we can really run the company well.
Let's back up for a second. Give us an overview of Compass Health. Just the goal,
Yes.
the problem you're trying to solve.
Compass Health is a patient-centric care coordination, care navigation company where we partnered with multiple physicians in any specialty. Started here in Tampa. We have a goal to expand into Florida and other areas within Florida. And what we do is, with the healthcare fragmentation that exists today in our system, people are tired of waiting. People are tired of not being able to be connected to the right physician. People are tired of going to the emergency room and not being seen by the correct physician. So we created this network of physicians that we call our problem number 1. Let's first fix access. How do I fix access? If I have a group of physicians that are going to see you within 3 to 5 business days. And what are those physicians? Every specialty. You name a specialty, we have it. Number two is quality. How do you discern quality in healthcare today? A lot of people, and I ask this question even to our patients, how do you know if the doctor you're going to be seeing is good? And they're like, oh, I go on Google and I see the number of stars they have. Is that really the best way that you're going to discern if that's quality? Or they're like, oh no, but I'll ask one of my friends, or I'll ask one of my neighbors, or I'll ask my primary care, or I'll ask a person that I saw one time that I trust. So who discerns that quality? Is it a system quality? Is there, everyone that is part of a specific system is a great physician? So we try to remove that layer of complication by adding a specialist network that we, and part of my co-founders, and we'll talk a little bit about, we vetted a network to say those are, in our opinion, and based on the metrics and the data, the best-in-class physicians. So that's number two. Access number one, quality number two, care coordination and care navigation. Those for me are probably the most important. Yes, it's amazing that we can see people within 3 to 5 business days. It's amazing that they're the best class specialists. But if I don't have things coordinated and navigated well, it's just not going to work. And I'll give a couple examples. Number one, imagine you have to see an orthopedic surgeon. You go to the orthopedic surgeon in a normal system, 3 months or a month for that case. You get in there and they're like, where's your MRI? I'm like, what do you mean? No one told me I had to get an MRI.
Yeah.
It's like, oh yeah, so now you have to leave this office. Thank you very much for coming. I'm going to put that order for you to go get an MRI. It takes you a month to get an MRI, right? So then you go get an MRI. The MRI results go back to them. But then it takes another month to see that orthopedic surgeon. Now it's been 3 months. You have your MRI. You saw, but sometimes that pain that you were feeling in 3 months, it's gone. Like you've taken pain meds, you probably have seen 2 or 3 physicians, you did MRI, but it's been 3 months. So what happened, right? Sure. The second, I think, scenario, and I'll give this as a personal scenario for me, is my brother. My brother was here in the United States. He lived in Michigan. He was moving at that time to Illinois, to Chicago. And it was very interesting to me. He had like this pain in his back. No idea what it was. It was a pain in his neck. He works from home. He couldn't stand in front of a computer. 7 months with pain. Wow. He saw 12 physicians. He blew up his entire deductible, right? 5,000, 10,000, I don't remember how much it was. But he saw so many physicians based on their availability that for 7 months he was on pain meds. And imagine he was 27 at the time. As a 27-year-old, can't work out, can barely sleep, you're barely working, peak of your life. And there's a lot of things you can't do because you're not seeing the right physician at the right time. So we solved that problem of you're going to be seeing the right physician at the right time. And by the way, if it's not the right physician, we're going to connect you to the right physician. And in his case, it took him 7 months to find the right physician. In one appointment, the guy figured out what it was, gave him an injection. 2 weeks later, he was fine again. Pain med's gone. But again, he blew his deductible. So what is that cost of care navigation and care coordination that we fix? We have a dedicated care coordinator that's going to manage everything for you, from managing appointments to scheduling the appointments, which if you are part of the system today, sometimes to schedule an appointment takes 30 to 45 minutes. Right? You call them, you're waiting, and then they ask you some information, and then you're waiting again, and then it gets scheduled. Well, our care coordinator schedules it for you, manages for you. If it needs to be canceled or rescheduled, we're going to manage that for you. Anything that needs to happen before that appointment, MRI test, we're going to schedule that for you.
Oh, nice.
So that the moment you get in there, the physician is ready to see you. And by the way, the moment you leave, let's just say you have any unanswered questions, you don't know exactly what happens next, we're going to be coordinating that for you. So it's kind of one-stop shop. I like to call the customer experience the American Express Platinum customer experience. You're calling one number. If you're traveling, if you schedule everything through them, they can manage the entire experience for you, from rental car to a hotel to you're lost to something happened to your car. They're managing everything for you. Well, in healthcare, that's what we're doing. We're coordinating the healthcare journey. So what it is that we do, patient-centric care coordination, care navigation with the bulk of best-in-class specialists as part of our network that will see you within 3 to 5 business days.
Amazing. As a clinician, I know you're addressing a very real pain point here. I've been thinking a lot about just how difficult it is to your point earlier, know that you're receiving the right care. my mother-in-law is sick right now, actually, and we've been dealing with her like in and out of the hospital. And my husband and I are fortunately both like healthcare, and so we know a lot. But even with all of that information and all of our training, it is still so hard to get the right answers at the right time and to get the right treatment. So I think it's really admirable what you're doing. I want to back up a little bit to point number 2, quality. You mentioned some data and metrics you use to kind of gauge the quality of physicians and who you like to partner with. Can you go into that just a little bit more?
Yeah, so both of my co-founders, they are part of the board of a very large system here in Tampa, and over the course of their career, 35 years one, 25 years another, there is enough evidence from a data standpoint, but also from having mutual experiences with the physicians that are part of our network to know who's who, to know what works and what doesn't. So yes, there is that composite score that we can, go a little bit more into detail. A lot of that is not readily available, but when they went through all of the selection of these physicians, there was a lot of that data aspect of this. And then we have what one of my co-founders love to talk about is we have also the extra layer of this, which is beyond having their quantitative aspects and their quantitative metrics, there's also qualitative metrics that we add on top. And it might sound silly to some people, but are you or are they able to have dinner or drink with you? And if they are, there is enough of that bedside manner, enough of that respect, enough of that honesty that we want to provide to our patients. Because even if they're the smartest ones and they're the best ones in surgery, but if they can't have that connection, that human connection to all of the patients, it becomes a little bit harder for us to have them as part of our network. So yes, there is the quantitative metrics, there is mortality rate, there is morbidity, like there's all of these things of how they are as clinicians, but there's also that extra aspect on how is it that they treat humans, how is it that they treat patients. Are they spending enough time with the patient, and they're here just to do the quantitative aspect?
I think that's so important because there is that therapeutic alliance between a clinician and a patient that, provides at least a portion of, the trust that it takes to really recover and to heal from something.
Right. One point that you brought up that I think is important that we talk about. So you mentioned, and I'm sorry about your mother-in-law. I like to just bring this because my journey so far in healthcare, it hasn't been that long, right? I haven't been doing healthcare for that long, but I think that's one of the things that I was craving as I was working in something that I was directly involved in the support of someone. I'm not a physician, but I felt like I was craving that. I really want to help people. And in technology, you do somewhat adjacently. As you're helping some of the customers that are helping other people and so on, there is a higher cause for everything that we do, and you can see the help that you provide to your colleagues. But at the same time, on the patient's life, a lot of time is something that is so direct that every day you're helping someone, it just gives you that energy boost of, yes, I just helped someone. And I'll mention a little bit about what you said is a lot of people, they get to a point that their spouse or a mother or a father or a mother-in-law or a parent or a sibling goes into that experience. And when they do, they just tell themselves, like, I wish I had someone that could help me go through this, because otherwise it becomes so much burden on you. I have to do the research. I have to take my mom. I have to do this. It just becomes so much. And by the way, these are for the ones that are fortunate to have someone that can help, because there are a lot of other people that find out, for example, their spouse has cancer and they get paralyzed. They can't help. It just becomes something that is so traumatic of an experience for you to go through that they're just like, okay, what did the doctor say again? That all they could hear was, my spouse or my partner has cancer. So we like to put ourselves in that situation to say, we're going to get to know you on a personal level. Our Tampa Bay Business Journal had an interview with us. We like to operationalize empathy. I really love those two words, because operations is really what we're good at, and then empathy is really, really what people are craving in healthcare. How do we get those two things? And for myself, every time I have my initial conversation with anyone that is joining us, I spend 30 to 45 minutes getting to know them on a personal level. And when they do the onboarding with us, our care coordination team is doing the same thing. So tell me about you. Tell me about your partner. Tell me about your medical history. Tell me about every single thing that's ever gone through with you, because something like that happens, you end up at the ER. You end up with some type of diagnosis that you might need help with, and something happens to your partner, we are here really to be able to help you, to be able to make sure that you navigate to the right physicians at the right time. Make sure that your primary care is aware of what's going on, making sure that all of your other specialists know what's going on. So I like to point that out is there's so many people that are going through this. There's so many people that a lot of times they just wish there was like a third party that knew them well enough to help. That a lot of that we have been finding out over the course of our journey, that that's where we really belong. We really belong as being someone that can help. It does, and by the way, if you're healthy, that's okay too, because at some point it might be something happens to you that you want to have, that you want to have someone that over the past 3 years or 5 years or 10 years checked in with you in somewhat of a standard mode that knew, hey, you did your checkpoints, you did your executive health checkup once a year, you did your labs, and we know enough over the course of this journey that the moment something happens, it doesn't become like, oh, something happened, now I'm going to get in touch with Compass Health. Oh, how do you do this over the course of 5 years, 3 years? Because when it does, we still have the best in class network at the right time, and we know you well enough that we can just communicate with the physician, hey, this person's been healthy for 10 years. Now something happened. It might be X, Y, and Z because we've known it well.
Yes. Very cool. Concierge care is really big right now.
Yes.
Are all of your providers providing concierge services?
No. And it's an interesting piece on the use of concierge. So I'll explain a little bit what we've seen over the past, I'll call 10 years. Over the past 10 years, maybe a little longer, a lot of physicians have seen that having a panel of 3,000, 4,000, 8,000 in specific systems is not what they want to do. It's not why they went into medical school to help patients. Because a lot of these visits are rushed. A lot of these visits are not necessarily what they wanted to do. They're not creating personal relationships with a lot of the patients. And some of them are. Mm-hmm. Some of them are like, yeah, I can do this in a 15-minute time frame. But realistically, it's very difficult in 15 minutes for you to understand everything that's going on. And for a lot of patients, that experience alone of, it took me 3 months to get my appointment and now I have 15 minutes with my doctor, how much are they actually going to understand from it? So we've seen this shift of going into, first, the wellness boom. People want to take care of themselves. Number two, AI, which is coming to give some of that access to expedite some of the aspects of the system that today don't work. But it's still that, do I want to talk to an AI? Do I want to talk to a person that is on across the screen, but then they don't know a lot about me, like what it is that I want? And then number three, which is, again, going back to the initial point, if I can open a practice that is concierge-like, reduce the number of people that I'm going to see, and I'm going to charge them a little bit for it so that they can get access to me 24/7, I might as well see a lot of success on it. But what are the consequences of that? Well, that person before, as an internist or a family medicine or a primary care physician, was seeing 3,000 people. Well, now they're going to see 300 because they want to be able to really not only charge for it, and it could be $100 a month, $150 a month, $800 a month. But then there's 2,700 people that don't have that opportunity. Why? Because some people are not willing to pay, because some people, are okay with the 15-minute meetings, but there is a need in there for some people to still have access to primary care, the way that the system is designed today, which the system is designed that the primary care is your first source of entry into the healthcare system, for you to be able to get referrals into specialists, for you to get all of your checkpoints, blood draws, whatever. That primary care is that first source. So when we talk about concierge, we talk about multiple things. We talk about access. Can I have access to that person pretty much 24/7? Second, do I have a location where I can go that it's not necessarily driven by the system? And then third, what else is the concierge service going to provide me that is beyond the access and, in theory, making sure that I can get access to the remaining system? So what we created was each one of these physicians, so we have 25 now, each one of those physicians, they still operate, they still see patients, they're still doing clinics at their own location. So they have their own location, they still accept insurance. So you can go in there and whatever it is, clinics, consults, you name it, surgery, everything's still going to be billed by insurance. We have a couple of few exceptions. And what you're paying us is for access and for coordination, meaning you're paying someone to actually be able to have access to these physicians, and then you're paying someone to do the coordination across all of them. And the best example is if you have to see 3, 4, 5 physicians, we're coordinating directly with your primary care. It could be primary care that we refer. It could be a primary care of your choice, or it could be someone that you use as a primary care.
Okay.
We're going to coordinate with any of those. So we call primary care agnostic. But when it gets to your specialist, if you see 3, 4, 5, 10, we're coordinating across all of these specialists. So going from the primary care, letting them know, hey, patient Josie just went from going to see you to see a cardiologist based on your recommendation, saw this week, now from the cardiologist needs to get an x-ray, and everything gets routed back to the primary care. So it's one of those, yes, we have a person, talking back to the navigator, having a person that's really navigating the system, not necessarily in a concierge fashion. That's why we call a little bit reimagined concierge, because concierge today is very much focused on primary care. And when he gets to see a specialist, it ends up being a lot of asking for favors. The primary care is asking for people that were part of their network, but then what are the specialists getting for it?
Sure.
So we created that system where the specialists are actually getting something for it.
Right. So the existing systems are sustainable, people relying on their connections.
Correct. Yeah. So how many patients can you see? Let's just say I have a cap as a primary care at 300. And at any point in time, hopefully that never happens, that 150 of them need to see a urologist in the same week. Are you going to call the same urologist 150 times on that week to see that patient? The urologist at some point is going to be like, hey, I can do a favor for 3 or 4, but I can't do for 100. Or throughout the years, how many times are you calling? And then some people just tell us, oh no, but I have 3 urologists that I can call, or 5 urologists that I can call. But do you think that the urologists don't have enough patients that they have to see because their wait time is already 3 to 6 months? Right, so it's like, how do you have a concierge and the physician that is a primary care that decided to move away from the system of seeing 6,000 or 7,000 to become, a smaller cap and make a little bit more money because now they can charge membership, to the specialist that is like, oh yeah, but the specialist is still seeing the 3,000 that you're seeing or the 4,000 that you're seeing. Why are they not ripping the benefits from potentially being able to do concierge? And then if you think about it even further is, okay, so let's imagine that if a cardiologist created a concierge practice, if an endocrinologist created a concierge practice, how many concierge memberships can you pay so that you can have access to all of them? Well, if it's 150 the primary care, 150 the cardiologist, 150 the endocrinologist, at some point you're just like, okay, I'm just paying membership. Why do I pay for any insurance for that matter?
Sure.
And I'm just going to pay everyone's concierge. So we created something where you pay one membership and you can have access to all of the specialists.
Okay. So you mentioned before, but I just want to clarify, are they still, when someone joins Compass Health and you guys connect them with a specialist, is it billed to their insurance? Are they paying a copay? Okay.
It is billed to the insurance the same way that it would.
Okay.
The only thing is that instead of you waiting 3 to 6 months to see that person, or a month, you're seeing that person the same week. So we're coordinating that for you, and I can give that example. So customer journey or patient journey.
Right, yes.
A patient goes to a primary care. The primary care says, hey, you need to see a urologist. They're part of Compass Health. They let us know, hey, I just left my primary care. I need to see a urologist based on X, Y, and Z. We connect them to a urologist the same week. We coordinate that appointment. We make sure that the urologist has everything and that the patient has everything. They leave the urologist. If there is any other recommendations from the urologist, we follow through. We make sure that the patient has everything that they need. Or if they need to see the primary care again, we schedule that meeting with the primary care based on whatever came from the urologist. But they're paying a membership to us to have access and care coordination to the specialists that are part of our network. Yeah. And then if you like your cardiologist that lives in a different city, we're still going to coordinate that for you. I just can't guarantee that cardiologist is going to see you within 3 to 5 business days. But from a patient standpoint, it's one person now that they're texting or calling to schedule everything for them. So imagine, I don't have to call the cardiologist anymore. I don't have to schedule the appointment. I don't have to do any of that. We'll do that for you. And our software will send you reminders. We'll make sure, hey, are you ready for your appointment tomorrow? You can text. And the beauty of it is, I don't know about you, but a lot of people have gone through this. You move states like we just did. I went from North Carolina to Florida. North Carolina, there was Epic. Yes, Epic. My wife was doing transfer care. Her Epic from up there, yet doesn't transfer to all of the data from Epic here. So what do I do with all of that data? that we had up there. Well, you asked the Epic from North Carolina or the hospital system, hey, can you send this to all of my physicians down here? That takes weeks. So what we do is, okay, you go there, you download, and then you can put everything in our platform, because we know that our care coordinator can access that and send all of that to your physician ahead of time, so that they don't have to go and request from North Carolina to be shipped onto you. So our software helps on appointment scheduling, coordination, making sure you have the data, making sure your documents are in there, we call records management, all of the HIPAA compliance around texting and messaging, it's all in there. So the technology piece is very important, but I like to focus very much on the 4 issues that we're actually solving.
Yeah.
Because the emphasis on AI today, like everything is AI, right? AI can do this, AI can do this, but I still have this opinion where there is going to be a lot of operational aspects that AI is going to help us. And by the way, that AI is going to help the patients be more informed of understanding exactly what's going on. But there's still that piece of, yes, AI can help me do all of this, but the moment I need something done and something is going on with me that I need to trust someone, people still want to call a number or get on the phone and say, like, I want to talk to someone that I trust. And that's where we come in. A person that knows you, that can schedule all of this for you, that can coordinate all of this for you. And again, inevitably at some point AI will come into play, and it's going to help us do all of those things a little faster, but there's always going to be a human component into this. And that's why we were talking about the team, we focus so much on growing a team that can excel so much on customer experience, because in healthcare today, customer experience is just not there.
Yeah, it'll differentiate you from like every other provider or care network.
That's the intent.
So said AI is gonna help.
Yeah.
Are you using it at all? Like, what's it helping?
We use AI. We use Claude. We use small little things here and there, like, from a marketing standpoint, some operational aspects, but it's not something that is driving our business today.
Okay.
Because as we grow and as we start selecting some of the network in other cities, it's going to help us a lot understanding partnerships, understanding relationships. There's a lot of the operational things that I can put on our platform today. Hey, upload all of my documents in here, give me an insight of everything that's going on with me. We're adding all of that as part of our app. We're doing all of the digital health now added to our app, so that it becomes something that the patients, if they want to look at it all in one place, they can. So there is an AI built-in aspect of this, but it's not the core competency of our business. We're not a company that is doing AI to do AI. We are a company that we're always going to focus on what's the human interaction, what are the things that we really want to make sure that our patients are going to have as an experience. And then, yes, we will add AI for you as a patient to be able to be more informed, for our care coordinators to be able to do what we call workload balancing. So we're adding that at the moment. A patient comes in, it's help with something, requested an appointment. We can do AI based on workload balancing. So there's going to be some aspects of that are going to be implemented as we grow, but not my company's AI and we want to grow to these 3,000, 4,000 patients in a week so that AI can do all of it. That's not where we're headed.
I think, the integration of AI into healthcare it's a hot topic. And I love building with AI. I'm, non-technical, but, I play around building certain things, that I find useful, as a clinician. I recently built something to just send me a download of all the research that's been published. Since every Monday morning, I get just a list in Slack of links of every article that's been published. So I'm using it in small ways that. But I think integrating it into actual care is going to be so challenging and controversial whether it's even the right way to go.
AI has a lot of ways of augmenting so many things that the humans do, from, hey, give me a rundown of everything every morning, which I love the fact that you're doing this. I do this in other ways. There's people that are doing that and then they send us an email first thing in the morning, so I just read their email because I'm like, hey, everything that is on no promotions, but healthcare brew, fit insider, all those, they're given Beckers send me an email every day on all the aspects that I want to read, and that has become, for me as a person that didn't come from healthcare, a lot of the source of information that I can read of what's going on in the healthcare industry that might impact who we are as a business. So are other AI companies that are coming out there and getting massive valuations and funding, are they working on the same problem that we are? And if they are, in what way?
Yeah.
Is it the coordination piece? Is it the navigation piece? Does it make sense for me to partner with them as we grow?
Sure.
So there is a lot of these AI pieces. Yeah, the rundown. I mean, all of my emails every morning. If I get a lot of emails, application. So the job application, there's a lot of AI built into it that can help you understand who are the best fit for what you're looking for. Of course, I'm always going to be, how do we do the interviews and etc. But it has that filtering aspect of it. So again, a lot of additional things that can help us. My care coordinator and I were working on something right now. All of our calls with all of our patients, they are part of a HIPAA compliance reporting mechanism. How do we start doing that? And I know scribing is something super important for physicians. How do we start doing that? Because we're talking to them, so that it summarizes for us too and inputs directly into our platform, so that our care coordinator doesn't have to do it. So these are like small things that the more that we learn about our patients, the more that we learn with the data we're getting, how agile and adaptable we can be to actually start implementing those things very quick. Listen, Claude and all of this OpenAI, I mean, they can do so many things.
It's hard to stay on top of.
It is.
Yeah.
It is. I keep looking every day. I'm like, which one is the best one? But I decided now I'm going to pick one and just do everything in one because it's too difficult.
Yeah, it is. It is. You have to have like another source and all summarizing things for you. Something interesting about like the scribing, and, you know, the things you mentioned with like kind of consolidating what your patient coordinator, care coordinators have to do. With the access piece you mentioned earlier, you know, if a physician's only able to see like so many people really provide the quality care that they feel like they want to and that the patient deserves, you know, if you're kind of making everything else very efficient, like if their notes and their billing and everything is super efficient, maybe they're able to see like a few more people and still provide for quality care.
And that's I think what a lot of these funding for all of these companies that are fixing small little things. One of the things, as you said, the rundown of news. I have a rundown of news that tells me which companies every single week are getting funded for a problem that they're fixing within healthcare. And there's been so many. And every week I see a little bit of a pattern. Oh, this person here, or this company here is fixing access to primary care. This one here is fixing the coordination within this and this specialty. This one here is fixing. So it would be very like transcribing. Like there's so many things of these companies that are fixing tiny little pieces that hopefully at some point there will be, if Epic allows, there will be this. They fixed everything that a physician has to do today manually. Maybe their staff, maybe what they do. Everyone talks about the pajama time, right? So that they fix those things so that the physicians are less burned out and they can actually see more patients. But is that also is the compensation in place today to allow physicians to do that? Because physicians are not billing for pajama time.
Yeah.
They're not billing for going home and spending 2-3 hours putting the note. Like they're not. You can't bill a patient for that. So I think there is a little bit of this controversy that happens today only in the US healthcare system, to my knowledge. That is, if I see this amount of patients, but you can fix all the other things that I have, am I going to see more patients? And if I do,
That's a good point.
What's the compensation that I'm going to get as a physician? Is it going to make me less burned out, or is it going to make me more burned out because now I have to see more people?
Right.
And then now that I have a shortage of physicians, which the shortage planned in the United States by 2030, according to the latest research, it's about 125,000 physicians. So if I don't have enough physicians, it already takes me a really long time to see physicians, and they're all burned out, or they're getting all burned out. Even if I fix a lot of the things that are not amenable to it, are they going to want to see more patients? I don't know.
Yeah.
Right? So we have to think about those things too, is that even if you fix all of those things and you don't have enough physicians, are they going to want to work more?
Yeah.
I don't know.
Yeah. I mean, maybe if, you know, something like your business, if things like run really smoothly, you know, maybe it's really not gonna burn out physicians to take on another patient care there, you know. And then also it's kind of like chicken or egg thing. Like, you know, maybe people are wanting to go to med school more if like their life after graduation looks a little better.
Correct.
And they're able to provide like the type of care that they, you know, grew up kind of aspiring to.
Correct. And it's very interesting coming from a different country, and the data came out a few weeks ago, which is in Brazil there's more physicians than there's jobs available.
Oh, wow.
Which is the opposite of what we're seeing here, where there's a lot of jobs available, salaries are rising, and not enough physicians to actually take those places. So how also the United States is going to start looking at, how do I fill some of these spots? And some of this is already happening. I think on the nurse front, there's a lot of nurses that are already coming from a different place, from a different country, that are getting well qualified to be able to serve in the United States. But how do you start looking at the physician population the same way?
Yeah.
Because as of last year, and if you foresee the future, the near future, there's going to be more physicians in other countries and there is jobs available. Does it make sense to create a program where it allows the re-education and the insertion into the workplace to happen in this country a little faster?
Yeah.
So that shortage goes away.
Which essentially is the goal of CaresLink. So hopefully as CaresLink grows, that's something we're able to help with.
Exactly.
Well, Raphael, is there anything you want to leave our audience with before we conclude?
Leave the audience with, I would leave the audience with, the healthcare system, yes, is fragmented. Yes, it's complicated. There's a lot that a lot of people are trying to do that is for the good of healthcare. And I like to think, and I talked to both of my co-founders who had the idea for this. They have been doing this as favors for people for 15, 20 years. But they finally got to a point where we as specialists, and both of them are specialists, we as specialists are helping so many people in so many ways by connecting them to the right people. How do we do that more? First, in a formalized way. That's how Compass Health got created. But two, how do we help more people than just our friends? We started with this, yes, with the membership, $300 a month. For some people might seem a lot to get access and coordination. For other people might be nothing. Yeah. But the moment you join and the moment we have seen our patients join, the benefits are just tremendous. Right. Yeah. People can't live without it. So I leave a little bit of the audience with this epiphany that I had 2 weeks ago, is that everything that we're doing are helping our patients. Every single thing. From the first call where hey, I went through a horrible experience in the ER, or I went through a horrible experience with like 3 of my physicians for whatever reason, to now that they have someone that can really support them along the journey, really from a results standpoint, just it's mind-blowing to me. But my epiphany was a lot around, we're really trying to help people. And if we focus on helping the patients instead of focusing on how do we grow the company, but help the patient day in, day out. There is that Disneyland mentality, right? The Disney experience that people go to Disney just to have a class in how they provide experience to all of their visitors. That's what keeps me in mind. Like, Disney's so focused on every single person that comes through that door. I am so focused on every single patient from when they call us. Yes, it might not be a good fit now, and that's okay. Or, hey, you called us and you're ready to join. We're going to provide the best experience possible that you can have, so that when you leave here, not only you're calling all of your friends that ever needed someone related to healthcare, but that you're also going a little bit above all of the problems that exist. Because can we fix every single problem? No. Are we going to avoid, unfortunately, having mortality? No. But we're going to try to make whatever it is that journey is going to be so well done operationally, so that every time we talk to our care coordination team, every time we talk to me, every time we talk to our co-founders, every time we talk to anyone that's going to come and join our team, that experience is just going to be something that, again, it's going to be focused on the patient. So I'd leave the audience with, first, if you're building a company, focus on the customer. 2, if you're building a company in healthcare, focus on the patient. And 3, I always ended with, be honest, be humble, be respectful, be genuine. Because even if this is not the one, even if this problem is not big enough that you're solving, if you're doing it all for the right reasons, okay.
Love that. Thank you so much for joining us.
Thanks for having us.